Matson. My pathology is scoliosis, and the two projections that I will be using to demonstrate scoliosis screening will be the AP and the supine of the spine. Most important thing that you will need right off the bat is two patient identifiers, which would be the patient's full name and their date of birth. Clothing instructions will be for the patient to remove everything except for their underwear, basically their shirt, their bra if they are a female, and their blue jeans, and any jewelry such as necklaces or maybe a belly button ring. You will also want to obtain a very detailed patient history for the radiologist. Okay, the first projection that we are going to do here is the AP upright. This is performed at a 72-inch SID, and also it is performed on a 14 by 17 lengthwise position cassette. You'll want a left marker on the right side of the cassette, about 4 inches in at the bottom corner. You will also want to position so that the cassette is right at the top of the iliac crest. So I'm going to find that here. I'm going to move it on up. Right there. Okay, and you'll want to move the tube right along with that. For positioning, you'll want the central ray going right into the mid-sagittal plane, so I'm going to move you a little bit to the right. Okay. And good. And we're also going to want to collimate in side to side, probably about 4 inches or so. This is due to not wanting to irradiate irrelevant anatomy, save dose to that, but we don't want to go in too far because you never know how far the spine is curved because it is for scoliosis screening. So we're going to collimate in here. We'll also want to measure here, so I'm going to have you step your arm. You want to measure right through where the central ray enters the patient. Measures about 24. For this exam, you will want to use a small focal spot for bony detail and also center chamber of the AEC, and you will want to take this projection on suspended expiration. The second projection that I will be demonstrating is the supine X-ray for the scoliosis screening. First thing I'm going to do is shield the patient's gonads. And this projection is done with a 40-inch SID. And for this, we'll be using a 14-17 by 17 cassette, lengthwise, same as the erect. And we will take a right marker this time and put it in the lower left side of the cassette, about 4 inches in, again, for the same reasons. And we will align the tube to the bucky. Right, and it's also in transverse detent. And for positioning, it's the same as the erect. We want to put the bottom of the cassette right at the top of the iliac crest, so we would find those. Find the ASIS, go up, find the crest. Again, the central ray goes through the mid-sagittal plane. Find that by finding the xiphoid tip. And then for collimation, we want to open this up to a 17. And side to side will be about 10. All right. And for this exam, we want to use small focal spot again for showing bony detail, and also center chamber of the AEC, and we'll also want to expose this one on suspended expiration.